Hi everyone, welcome to another video tutorial of CAPSA. In this tutorial, I will discuss about H. pylori infection. So let's understand about brief introduction of H. pylori based on microbiology. It's a microphilic bacterium. Microphilic bacterium means that have the ability to grow in low oxygen level environment. How much amount? Like 2 to 10% of oxygen level environment. Formally recognized as bacterial carcinogen. Why known as bacterial carcinogen? Because this kind of bacteria are linked with cancers in human bodies. These are spiral or cocoid shaped, 3.5 micron long and 0.5 micron wide. Cultured in vitro on blood agar media or selective media, it has Lophotrichus unipolar flagella. Lophotrichus means there are bunch of flagella which will originate from one point, and this kind of flagella helps them in polar motility. Polar motility means corkscrew like motion. So if there is a lining or tissue lining, and if this is a Helicobacter pylori bacterium which shows the Lophotrichus flagella, it will shows corkscrew like motion which will helps to invade into the tissue lining. Okay, now the question is where the bacteria causes the infection. Okay, so the bacteria actually causes infection in stomach. So obviously there in the stomach pH range is high. So if there is high pH range, the bacteria needs to creates a low environment to survive. So for this purpose, it activates its cytoplasmic urease. You can see in the picture cytoplasmic urease which converts urea into carbon dioxide and ammonia. And this ammonia neutralizes the gastric acid and creates a low acidic environment which helps them or the bacteria to survive in the gastric acid. Okay, now we will understand how do you get infected by H. pylori or from what is the mode of transmission. So it actually passes from person to person through the direct contact with saliva, vomit, stool, etc. Besides that, it can also infected from flies, infected flies from food, any kind of contaminated water, poor hygiene, or if there is poor sanitation, this kind of things. Now, what are the infections mediated by H. pylori? These are chronic gastritis. Gastritis is inflammation of the gastric lining. Peptic ulcer, it means wound, creation of wound in the gastric lining, okay, or lining. Gastric cancer, gastric mucosa mediated lymphoid tissue lymphoma. This kind of infections are mediated by H. pylori. These are common, these two, but if there is any severe condition, it will leads to these two infection. Okay, now how the H. pylori causes this kind of infection? That is the question. So obviously it will enter the stomach. So it enters into the stomach. After entering into the stomach, what it will causes? It will attaches to the stomach lining. So it will attaches to the stomach lining. Okay, after attaching into the stomach lining, it will obviously activate its cytoplasmic urease which will create a less acidic environment. Okay, so it will produce urease enzyme. Okay, so if there is less acidic environment as a body's defense mechanism, obviously there will be increase in the acid production. So as a result, it will causes increase in the acid production. and also it eats the stomach tissues. Why? Because to grow faster, to multiply, okay, which will causes the gastritis, ulcer, this kind of things, okay, and also it produces some toxins which causes severe cell injury. So this is the procedure of H. pylori infection. Clear? Now we will see some pictures. So this picture, first picture represents the wound formation or the ulcer, peptic ulcer creation. And this picture represents the formation of lymphoma slowly, which leads to cancer. First you can see in the first picture, lymphoma is started to grow. Okay. And in this picture you can see there is gastric cancer. Okay. Now what are the symptoms? So first symptoms is you will feel burning pain in the upper part of the abdomen. Second one is bloating, dyspepsia, nausea, vomiting. Dyspepsia is simply stands for indigestion. Presence of blood in your stool, or you can see dark stool. Weight loss, halitosis. Halitosis is stands for bad breath or foul odor from your breath. Due to, it is studied that due to increase in the H2S concentration. Clear? Now what are the diagnostic procedure? So there are some diagnostic procedure which is performed to confirm the presence of H. pylori infection. First one is urea breath test. So in this test actually involves swallowing a liquid or pill containing urea. Now you know that H. pylori breakdowns the urea. So after swallowing, you breathe into a bag or container and then exhale into the same container again several minutes later. The amount of CO2 you breathe is measured before and after the swallowing. The amount of CO2 is measured. So if the test is positive, you have H. pylori infection, and if the test is negative, you do not have the H. pylori infection. Now it is the method of choice, considered as the method of choice for checking the status of the presence of H. pylori for pre and post therapy. Clear? Obviously you can do this kind of urea breath test at home using this kind of kit, but patients may be given this breath test kits by their doctors to administer at home, and it takes only 40 minutes, near about 40 minutes. Okay. Second test is stool antigen test. So this test involves collecting the stool sample and testing it for the presence of H. pylori antigen. Third one is stool PCR test. So if there is any kind of antibiotic resistance shows, this test useful to identify the mutation of the H. pylori. Fourth one is blood test. In this test, a sample of your blood is tested for presence of antibodies against which is created against H. pylori bacteria. And fifth one is, which is a standard diagnostic procedure, that is endoscopy with biopsy for the examination of or histopathological examination of gastric mucosal lining, and this test is known as EGD. EGD stands for esophagogastroduodenoscopy. Clear? Now we will understand what are the treatments available. Obviously treatments are medicines, no other options. So for the treatment, first is triple therapy is introduced. In the triple therapy, three kind of medicines are used. First one is proton pump inhibitor, second one is amoxicillin or metronidazole, third one is clarithromycin. So proton pump inhibitor, you can use lansoprazole, esomeprazole, pantoprazole, omeprazole, any one of the things. Lansoprazole dose will be 30 mg Esomeprazole, you know, 20 mg, pantoprazole 40, and omeprazole 20 mg. And it is given BID. Amoxicillin dose must be 1 gram BID. Metronidazole dose is 500 mg. It is also, no, it is TID. Clarithromycin is given 500 mg, which is BID, and this therapy is known as clarithromycin based triple therapy. Clear? And if it fails, quadruple therapy is started. Means 4 medicine is used, like 1, 2, 3, 4. PPI, this kind of lansoprazole, esomeprazole, pantoprazole, omeprazole. Bismuth subcitrate dose should be 120 to 300 mg. Okay. Bismuth subsalicylate, the dose will be 300 mg. Both are QID. And metronidazole dose will be 250 to 500, 250 or 500 QID. Tetracycline dose is 500 mg QID given. Okay. And if this quadruple therapy also fails, levofloxacin-based therapy is started, where PPI plus levofloxacin 500 mg plus amoxicillin 1 gram is started. And there are also some natural remedies available, but that can be the supportive treatment for the H. pylori infection, like consumption of green tea, broccoli sprout, cabbage juice. You can consume raw or cooked garlic, this kind of things. But before you trying these natural remedies, I will suggest you should discuss them with your doctor, because it can cause potential interactions with medicine, which is known as food drug interactions. Clear? So this is the end of my lecture. If you like the video, please hit the like, comment, share and subscribe. Thank you for your attention.